So we're going to talk about the musculoskeletal system, which is chapter 38 in your textbook. You need to know that the musculoskeletal system performs many functions. It supports, protects, and it is also responsible for movement. There are two subsystems. There are the bones and joints of the skeleton, and then there are the skeletal muscles. The other thing that you need to know is that the musculoskeletal system is composed of bones of the skeletal system, cartilage, ligaments, tendons, skeletal muscles, and joints. Remember we talked about the how to review your chapter, look at your learning outcomes, look at your key terms. If there's anything as far as key terms that you don't understand, make sure that those are the ones that you pay attention to in the chapter. When you look at the learning outcomes, by the time you have studied or read through, listened to the podcast, or looked at the notes, you should be able to answer the learning outcomes questions. If not, those are the things that you need to make sure you go back and review. We don't focus very heavily on anatomy and physiology because most of you have had anatomy and physiology classes. So we just kind of do a little bit of touch on anatomy review. So one of the other things you need to know is that bones store minerals, and it serves as a site for hemopoiesis, which is blood cell formation. The other thing, your bone cells include the osteoblasts. These are the cells that form in the blood. The osteocytes, these are the cells that maintain that bone matrix, and your osteoclasts, which are the cells that reabsorb the bone. And then your osteoprogenitor cells, which are the sources of all bones cells except those osteoclasts. We just talked about, at the very beginning of the podcast, the osteoblasts, the osteocytes, the osteoclasts, and the osteoprogenitor cells. But the one thing that I do want to tell you is I think it's important because this ties back to the endocrine system and kind of gives you a little window in of how our body works as one big essential unit. Right now, we're at the stage where we're taking all these systems and we're doing them system by system, but I would like to try to start connecting a little bit the systems to other systems so you can see how that works as a whole. So one of the things that you need to know, bone remodeling is controlled by this negative feedback system. What happens is the parathyroid is stimulated. Well, the parathyroid hormone, your PTH, is stimulated from the parathyroid glands and calcitonin. Remember, that went with endocrine. It is also stimulated from the thyroid. So when your blood levels of calcium decrease in the body, that parathyroid hormone is released. Then that stimulates these osteoclasts and bone reabsorption so that the calcium then is released from the bone matrix. Then what happens, the blood levels start to rise, and when I'm talking about the blood levels, I'm talking about calcium. So the calcium level goes back up, and then a stimulus is sent to the parathyroid hormone to stop releasing, to correct the problem. Just like when we talked about the ABGs and how important the pH is, and it always tries to maintain a balance between acid and base, this is the same kind of concept when your calcium levels become low. The parathyroid is responsible for the calcitonin, so it sends out the hormone of parathyroid hormone to stimulate the release of it to build up those calcium levels. Then once they become maintained or balanced, then a stimulus goes back to tell the parathyroid to stop producing the parathyroid hormone because we are back into our homeostasis state. You do need to be familiar with the bone shapes. There are long bones, short bones, flat bones, irregular bones. And this is a picture from your textbook on page 1289. Long bones are mid-portion or shaft. They're called diaphysis, and two broad ends, which are called the emphasis. They are compact bones. They contain marrow. Long bones include the bones of the arms, the fingers, the legs, and the toes. Then you have short bones, which are your bones in the wrist, and in the ankle. That's your short bones. Your flat bones are thin and flat. They're mostly curved, so you can imagine that your flat bones are part of your skull, part of the sternum. They're also part of the ribs. Then you have irregular bones. Irregular bones include the vertebrae, the scapula, and then the bones of the pelvic girdle. So just to recap, to show you for the long bones are the bones of the arm. They are also the legs. They are also the fingers, and then the toes. Okay, so make sure you kind of review that just to have an idea of what bones are considered what area of the body. One of the other things I want to talk about when we're talking about the musculoskeletal system, there are three types of body muscle. You have skeletal, smooth, and cardiac. So you can see that the skeletal muscle is attached to and covers bones. It helps with body movement, maintains our posture. It's also important for producing body heat. And then you have your smooth muscle, which is non-striate, involuntary. So it can't move. It's the muscle in the wall of your bladder, your stomach, and your bronchi. Then we have the cardiac muscle, which of course is essentially your heart. So just make sure that you kind of review back over the three types of muscles if you're not familiar with them. They are on page 1290, just to kind of give you a refresher. The skeletal muscle also has functions of excitability, contractibility, extensibility, and elasticity. So that's just a short kind of review of the three types of muscles. This is a table out of your textbook on page 1293, I believe. Yes, 1293. It is the descriptive words that you would use for documentation purposes. I'm not going to spend a lot of time reading this over for you. You guys can look at it. If you're not familiar what abduction means versus adduction, then make sure that you look it over and review it, because these are the terms that may be in a question regarding the musculoskeletal system, and if you don't know the difference between inversion and eversion, then it may sway your answer. So these are just kind of terms to be familiar with if you didn't already know them, for you to look over them. The other thing that's always a big component, which we already talked about when we did the review of how to go through your textbook and how to study, is also on page 1293. There's your genetic considerations. So this is specific for musculoskeletal. That's always an important box to review. So we're going to start talking about some of the tests we discussed on kind of going through the list and looking at them as a whole and trying to pick out the ones that maybe you don't know much about that are specific to this actual system. With the musculoskeletal system, there's really not a ton of different tests. The biggest one, well, not the biggest one, but one of the ones that's pretty common that they will do on the musculoskeletal system is the arthroscopy. This is where they're actually putting that endoscope into the interior surface of the joint. They're trying to diagnose any disease in the patella, the meniscus, the synovial and extrasynovial membranes. So a lot of times if patients have been having pain in their knee and they've maybe tried a couple of cortisone injections and that didn't seem to help, then they're going to go in and they're going to do an arthroscopy where they can go in and take a picture or go in and look and see what's going on, and maybe if they're able to, they could do some minor repair where they would be able to remove fluid or do a biopsy. The special nursing considerations for this is they cannot eat or drink after midnight. You always want to assess bleeding, swelling, and they do need to avoid excessive exercise for 2 to 3 days because you don't want any excess pressure on where they've went into that knee and they have manipulated it, and ice, because ice is going to always help with the swelling. The next one we're going to come down to is the DEXA scan, which is called bone density. This is one that's pretty common. It's used to evaluate bone mineral density, degrees of osteoporosis. This is something that does not need a special preparation for this particular test. They're actually calculating the size and the thickness of the bone itself. With a bone scan, this is a picture of a bone scan over here on the right. They're using the radioisotopes, which we've talked about in some of the other systems. That radioisotope allows this glow over the area of where you're trying to assess so you can see any abnormalities. You're looking for osteomyelitis, osteoporosis, or cancer. That's what they're essentially trying to diagnose when they're looking at a bone scan. The other thing is there is no special preparation. The patient does need to increase their fluids after because they're getting a radioisotope. We want to get those dyes or radiation type things that they use out of their system. We don't want them lingering in their kidneys. The other thing that comes up, and we're still on page 1294, is the electromyogram, which is also known as an EMG. What this is actually doing is looking at electrical activity of the skeletal muscles at rest and during contraction. You cannot have any caffeine, no smoking 3 hours prior to the test, no muscle relaxants, anticholinergics or cholinergics. Those will sway the test. The other thing that you need to know is that they cannot have any fluids prior to the test for 3 hours. The one thing that I did not mention with the EMG, they're measuring the activity of the skeletal muscles at rest and during contraction. The way that they're doing this is they're inserting needles that are measuring that activity. So this is considered an invasive procedure. They're sticking pins into your body, so it's not a mild procedure like a chest x-ray where they're just taking pictures. Then the next one I have on here is the SSEP, which is the somatic sensory invoked potential. It's kind of a nerve conduction test where they're measuring the actual nerve and its conduction. You guys can review over that test. It's not a test that you see very often. The other tests that are left is the CT, MRI, and X-ray. We've talked about the CT, MRI, and X-ray and all of the systems, so they're pretty standard. There's no difference. It's just a different system that we're looking at. The one thing, though, that we have not talked about is this particular chapter talks about some lab values that are not on your need-to-know lab values. You do not need to know the normal values of the labs, but I do want you to be able to recognize that the alkaline phosphate, which is also called ALP, is used to identify bone disease, and if you have an elevated level, it could indicate bone cancer. The other thing is, of course, we're talking about musculoskeletal, they're going to do a calcium level. Then they're going to do...
Sorry, I know I didn't.
Oh, sorry. I'm in my office today, so I had just several people stop in. So sorry if you heard any disruption or breaks in between the slide. So we were talking about the different blood levels that can be done for musculoskeletal. Phosphorus is the other one that can be done. You do want to note that if you do have an elevated phosphorus level, it could indicate bone tumors, and it can also indicate healing fractures. The other thing is a rheumatoid factor. This is something that is drawn to help diagnose rheumatoid arthritis. It will also be elevated in patients with lupus and scleroderma. Both lupus and scleroderma are similar to rheumatoid arthritis because they are autoimmune diseases, so they will be elevated. The other thing is the uric acid, because it's used to diagnose gout, and we're talking about the bones, and gout is related to that. The other thing is, we had talked about way back when in cardiac, the creatine kinase. And remember I told you the creatine kinase is a basic lab test that is done, and it's looking at muscle disease. And then they have the little subsets. When we talked about cardiac, it was creatine kinase MB, which was specific to the heart muscle itself. So just kind of look those over. You do not need to know the normal values for those, but you do need to know if they're elevated or if they're low, what possibly that could indicate. Okay, so now we're going to talk about the actual health assessment interview. We just went over the blood tests. The other thing we didn't talk about on 1296 are your age-related changes. Remember, that's an important key box because we have to know what is normal for the musculoskeletal system in the elderly patient. As you get older, things change, and we need to be able to differentiate what are some of those changes. For example, with the older adults, it is normal to have a decrease in bone mass and minerals. It's also that decrease, as well as the bone mass, they decrease calcium absorption, which can contribute to what? Thinner and weaker bones. What does that lead to? Well, it puts them at a higher risk for falls and fractures. So we always want to keep in mind when we're doing the health interview that we're looking at, or we're aware of age-related changes. We're also wanting to be aware of home environments, which takes us over to page 1297, which goes over all those health interview type questions that are specific for the musculoskeletal system. You know, is there rugs or throw rugs? The elder population, for whatever reason, is notorious for having throw rugs or those big oriental rugs all over the place and all over their house. Well, that's a potential falls risk, and if we already have a decrease in our bone mass and have a higher risk of falls, we definitely don't want anything invading that safety in the environment. So make sure that you look over those types of interview type questions. What would you consider health perception and health management type questions? And these are things that you would be asking in the health history assessment. So when we start on page 1298 and we start talking about the actual musculoskeletal assessment, we're looking at when the patient walks into the room, their gait, their posture. You know that elderly patients can have kyphosis. So what we need to know, is that common in older adults? And it is. It's common that they have a kyphosis, which is a exaggerated thoracic curvature. Then that's your picture on the right. Your other picture, of course, is a patient with scoliosis, and that's the S-shaped curve of the spine. It is also one of those that is typically found in adolescents. So one of the other things when we start to come down with the musculoskeletal assessment is you're just looking at the joints in general for deformity, swelling, and redness. You're palpating the joints. You want to know if there's warmth or crepitation and consistency. Then, of course, you kind of start into on page 1298, about almost to the bottom, we start with the range of motion assessment. This is more of an in-depth assessment that a nurse practitioner, a physician may do. I'm not going to have you guys really in-depthly memorize this particular assessment with the range of motion. You guys can kind of glance over it. Some of the terminology that goes along with the joints is the Huberdens and the Bouchard nodes. They're common in osteoarthritis, where the boutonniere is common in rheumatoid arthritis. Those are some of those terms that NCLEX may use in a question on board, so just make sure you're familiar with those terms and what disease they go with. So then that would take us all the way over to page 1301. So with page 1300, that's the continuation of the range of motion assessment. Just kind of glance over it, don't get crazy with it. However, when we get to page 1301, we start to talk about something called the Phelan's test. The Phelan's test is important because you are trying to indicate carpal tunnel syndrome. You do need to realize that you ask the patient to hold their wrist in an acute flexion for 60 seconds, so they're back to back to each other, and there should be no tingling, numbness, or pain. You do need to be familiar with the Phelan's test. The next one coming down is called the bulge test. The bulge test is where you're assessing for small amounts of fluid in the knee. You actually, and there's a picture, are milking upward on the medial side of the knee, and then you're tapping on the lateral side of the patella. There should be no fluid on that medial side of the knee. Then we come down, and the next test on page 1301 is called the Bolliment test. This is used to detect large amounts of fluid in the knee. So here you have two tests assessing for fluid in the knee. You need to know which one assesses small amounts versus large amounts, and the actual procedure of how to assess that. The Phelan's, the bulge test, and the Bolliment, you guys will also practice in lab. Then when we flip over to page 1302, we are talking about the McMurray's test, and it shows you a picture of the McMurray's test on page 1302. What you're essentially assessing for is pain and clicking. If there's pain or a popping sound, may indicate an injury to the meniscus in the knee. Then the next one is called the Thomas test, and you're looking for hip flexion contracture, and this will cause the extended leg to actually rise off of the table. So please review those. I think it's about 5 different tests. Those are the ones that are the most important for musculoskeletal that you really need to be aware of. There are also some pictures of the Hubens and the Bouchards and boutonnieres on the rest of your PowerPoint, and then some pictures of gout, and then I just inserted the pictures from your textbook with the Phelan's and the bulge, Bolliment, McMurray's, and Thomas. I'm just not going through each of those slides, so they're after this concurrent slide. So make sure that you listen to the podcast, review over those tests, because you guys will do them in lab. And I will see you after spring break.